Hello, this is Dr. Keith Miller, president of the Pennsylvania Chiropractic Association. I literally just got off an hour and 3-minute Teams meeting with the higher-ups at Helion, Predictal, and Highmark, going through all of the errors and problems that all of you thankfully have submitted. And here's where we are. So if you see me glancing off my screen, it's because I'm looking at my notes. I apologize. So one of the big issues was initially chiropractors couldn't get PM services covered at all, physical medicine services. There's no way to do it. Apparently, between December 4th and December 22nd, that was when it happened. And on the 22nd, midday, they updated the system where they were requiring chiropractors to do the chiro auth, come back out of the system and go into the system for a second auth to get the PT benefits covered or the physical medicine 97 series codes. And they never communicated it to anyone. Some representatives told people on the phone, but otherwise, unless you got lucky and got a rep who knew what was going on, you didn't know that. Now, we put out a video the first week of January recommending that to people because anecdotally we heard that was going on, but we just verified that. So my understanding is that the dates of service of 12/4 to 12/22, where your services outside of the 9894 series codes were all denied 100%. Good news, Highmark has agreed, based on us asking, very pretty please with sugar on top, that they are going to be auto-fixing them. Now, what does that mean? We have no idea. We know they're going to do it, but there's so many problems going on with this Availity system and the Predictal system, and it's not just Chiro, that it will take some time. They will let us know when they get submitted, so we can let you know when to start looking. My guess is don't look for those to be auto-processed until at least February. Next, backdating. A lot of you are still angry at the 21-day backdating because the system wasn't working. So now that the system's finally working and you're trying to get stuff done that you were getting error codes before, it's telling you it's too late. Now the rules are going forward, and they're going to be hard-lined on this. 21 days hard-line. You could do retro auth by fax from day 21 to day 30. And after day 30, you're going to have to mail in. So going forward, that is definitely going to be the rules. However, in the meantime, it's not your fault. So we kind of stuck to our guns on this. We requested that for those dates of service in there for the first 45 days that the system is active, that all those rules go away and providers have carte blanche from now till the dawn of time that they can go back and resubmit those items, because at the end of the day, it wasn't the provider's fault that the system had glitches and errors. So they're bringing it back to their team, and they're going to take our suggestion, and they're going to see about whether or not they're going to allow that 45-day look back. No promises, but we fought hard for it. Here's a big bad one. The letters all of you got in October saying you are a tier 1 provider and you get 12 no longer exists. The Tivity's Pathway tiering program ended completely on 12/4. They sent out letters that apparently some providers got, but most didn't, that said, congratulations, you're now part of a high performance network. Nobody knew what the hell that meant. What that means is high performance network now was a substitution for Tivity Pathways. So that was the substitution. And what that means is that the 12 visits that you were getting tier 1 before no longer will ever exist again, ever. Yes, that is correct. It will no longer ever exist, ever. But if you were tier 1 before, you are tier 1 now. So the patient gets the same discount. However, the perks that you were getting are different. Now they're telling us that people who are tier 1 will be getting higher numbers. So we're guessing that's why some of you are seeing 10 and some of you are seeing 6 to 8. But that's why. So anyone who is wondering why you're not getting 12 and when is that going to be fixed? Apparently it's never going to be fixed. But the tiering metric rules for 2024 are based on it. So your tier for being tier 1 or tier 2 is the same rules as the pathway system through the end of the year. Come January 1, there will be a new tiering set of rules and you will be placed in a new tier. Now, we kind of, were pretty forceful on this, saying, well, what are they? What's going on? When are they going to be published? Their belief is that somewhere early to mid Q2 of 2024, the new tiering metric rules will pop up. They said once again, they can't guarantee it, but the hope is definitely before the end of Q2. They're trying as early as possible. But unfortunately, there's so many problems and so many glitches with all this going on in so many different systems that they're having to prioritize. And we're unfortunately not the top priority as chiropractors because there's so many problems going on with the Availity system. So just a heads up on that. 10 is about the best you're going to get. We also let them know that a lot of providers have been telling us that, and you probably know this too, if you just do an auth and give no information, no notes, no documentation, no uploads, no faxes, you're more likely to get the top, which is 10. If you sent in your notes with an MRI report and everything else that goes with it, you got 6. And it made absolutely no sense to us. Now, they promised us that that was not an intentional thing. They're not sure exactly why, but they are going to run the data and the metrics and see if that's happening. If it is, they're going to figure that out and correct it. So it is a glitch. It's not intentional. And like I said, most of the stuff on this problem so far has been glitches, and it's just been stuff that's going on, and they are really intensely and honestly trying to fix it. They don't want any bad will from providers. And we know that there's been a lot of providers who have angry patients right now because they're being told, like, look, we can give you the services, but we can't guarantee payment. So hang tight. Highmark is really trying to work on it, and the PCA is item by item and detail for detail going through it. Let's see, Availity versus Navinet errors. A lot of people are telling us that they're looking in Navinet and it's saying definitively you need a PMMP, you need physical medicine management. And in Availity, it's not saying that. And then they're confused, and that's one of the reasons why they're trying to retroactively audit it. So I need help from a few of you. So if you see that Navinet says you need it, an auth, and Availity says you don't need it, I need you to print those out as PDFs, the full information. So black out their name, their date of birth, but leave all the other relative ID numbers and everything else. And I need you to email those to pca@penchiro.org today. So talk to your billing staff, talk to your front desk. If there's been clear examples, Navinet says yes, Availity Predictal says no, that you don't need it, I need them immediately. If I can get like a dozen of them really quickly, they're going to look to see why on those particular plans they believe it's certain books of business, certain sold programs that it's occurring in, but they want to identify those plans. And if that's the case, they can make a system edit and correct it, but I need your data to make that happen. Additionally, we're still fighting the bundling issue where your CMTs and E&Ms are getting bundled, as well as your CMTs and your 97140s are being improperly bundled. We're seeing it in cases where a patient hasn't been seen in a year or a year and a half, so you're doing a re-eval because the patient hasn't been there in over a year, and they're getting denied saying that it's not necessary because you've already done an exam, which we all know you need a re-exam, especially if it's a different body part or a different issue, a year to a year and a half or 2 years later. So I want you, once again, if you have any recent examples of bundling for E&Ms or manual therapy, I want you to, once again, HIPAA sanitize the name, date of birth, etc. Leave all the other data points on it. I need you to scan it, PDF only. Please do not give me phone shots, and send it to pca@penchiro.org. So that's a lot. We are working with Predictal, Helion, and Highmark to create new FAQs. If you go to the PRC, the Highmark PRC website, if you literally just Google Highmark PRC, it'll come up. There are new videos out that are updated on how to properly do a chiropractic pre-auth so you know which boxes to check. If it says you're getting approved for 98940, we were told that it is a global for all 989 series codes. That's 40 through 43. are approved on that. It's not just the 98940. We ask them specifically that we want to see the approval say manipulation services, physical medicine services, exam, and x-ray, that we want all four of those things on the off, not just 98940. This way doctors could go ahead and know what they're going to get paid for and properly inform, as we're required under federal law, of what we're supposed to be able to get paid for and what the provider, so you shouldn't have to do ABNs. It was a very productive meeting. Because there's so many issues in the holidays and everything else, that's why it was delaying Highmark getting back to us. We have a follow-up meeting in about 2 to 3 weeks. We'll have more information. We're going to keep updating you. This is probably the longest video I've put out in a while. I apologize, but there's a lot of information. The PCA is your only advocate in Pennsylvania, making sure that you're treated fairly and that we are there to support our providers and to get these things fixed for you. We're moving ahead. We are not taking these for granted. Please send me your data on the things I request. Help me help you. Don't assume someone else watching this video is going to send it in. If you know you have those problems, I'm working hard. It takes you 5 minutes to scan me that stuff. Please send it to me. If nothing else, if you send me your data, you're more likely to get your stuff fixed first. So I want to thank Casey Phillips, who's on the call today as well, one of our Highmark chairs, Justin Miller, who is on our Highmark committee, as well as our UPMC chair. Thank you very much, guys, for being a part of it. And please send me your data. Once again, Dr. Keith Miller, and I will give you updates ASAP as soon as we know them. Bye, guys.